Probably my first question I ask people if they're new to me is, how'd you hear about us? And usually I look for a connection. Almost everybody in our practice knows somebody else or somebody somehow. They've been referred to us one way or the other. And then that's a chance to kind of strike up conversation. If it's somebody I know in a preventative visit, probably the first thing I ask out of the gates is, are you exercising for me? You know, and then how and why. And then we also talk about diet and then other questions they might have. So. Yeah, we're very proud of our EMR that we have called eClinicalWorks. It affords patients connectivity like they've never had before, called a patient portal, and we actually really encourage their use. I think it creates more seamless experience for them, and it's safer. They get to say exactly what they want to say. For example, they can text/communicate directly with the physician. So it's not a game of operator where they call the nurse, they don't get the nurse, they do a voicemail, the nurse doesn't take off the voicemails for an hour, there's 5 or 6 voicemails, they're transcribing or paraphrasing what you're saying, then it gets put into a note, it gets sent to us, and then when we're between patients, we see it, we write down what we want, the nurse tries to call you back, she misses you, she tries again, you try to call her back, she misses you, voicemail. Finally, after 3 attempts and 6 hours later, she contacts and she paraphrases again what I said. Now, with our portal, we can skip the whole thing and we can have you say exactly what you want to say to me, and frankly, you usually get a response back far faster than you imagine, directly my words, as well as I can intervene, call in a prescription, whatever. And a lot of times the worst is when you're playing that phone tag, maybe not everything's clarified. So then you send another message to the provider. Oh, but she really wanted to also ask you about this. And then the game begins again. If I don't have exactly what you want when I reply to you, you bing it right back to me directly, and we go bing, 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 bing. And sometimes we'll send messages 2-3 times until we get it hammered tight. No game of operator, no concerns about slip between the cup and the lip. It works great. So we love it. It's safer, it's faster. Patients love it once they have the confidence to do it. I think the biggest limit is people are afraid to use a portal for healthcare. It's a big deal, you know. A classic situation is someone will use the portal to do a refill, and then they'll call the voicemail to say, did you get my refill request? So, I mean, that's a lack of confidence right there, and we get that, and so we want to breed confidence on that kind of stuff where you do it, and I don't blame you. It's a medicine. It's important. You know, you don't want to run out of your blood pressure pill or your diabetes insulin shots or something. So we want to breed that confidence in the portal. It is great. It is safe. It does work, and the more we can get you guys patients to do that, the better. So. Patient-centered medical home has a lot of virtues, and one of them is accessibility. For example, the portal, but also evening hours, which we have Monday through Friday till 6:30, and now Saturday hours, which are expanding rapidly. It's also, of course, you can catch us on call if you need to. In addition to that, we do a lot of population management. So we use our computer systems to follow whole populations of like all of our diabetics, and we can now see, for example, which ones have not been in 6 months or fallen out. So we don't have to necessarily wait until you call us or call for a refill or have a problem. We can kind of reach out and take care of our patients beyond our walls. Also today we have a program called Chronic Care Management. We have a manager that manages Medicare populations that have multiple chronic diseases. We have over 250 in this program, and we reach out to them every month, and we try to give them a phone call every month if we can contact with them and manage them proactively. Again, we don't wait necessarily until they come into our walls. You know, a new PCMH, a new practice takes care of our patients whether they're at the visit or not. And so we're using our technology to do that a lot, as well as we have dedicated personnel to do a lot of that. Probably more than why, which is a spontaneous answer that came with my first senior partner. He kind of turned to me my first year out, and he's like, why'd you get in medicine? And without even thinking, you know, you speak from the hip, I just said, the stories. I love the stories, you know. Getting to see people see life. I've delivered 160, 180 babies, although I don't deliver babies anymore, and that's okay. But, and I've seen people at the end of life. We do home visits for hospice patients and stuff like that. So I just like to be a part of people's lives and kind of see it unfold. I'd like to think it makes me wise, but I don't know if that's true. Increasingly, my kids. I've got 3 kids who drive me nuts, but I love them. I probably shouldn't say their age because they'll date this video, but they're 11, 9, and 7, and so we spend a lot of time with them. I run a lot, not as fast as I used to run, but I still run a lot. I read a lot for leisure, as well as, of course, professionally. My wife is my best friend. We hang out a lot together. When I'm tapped, you know, I like a good hard day where I'm kind of drained emotionally and physically, and know I did my best. There are days when you just know you were right on, and you really gave great care in all the visits, and you just know you synchronized with the patients. They walked away confident and like they understand their disease. And there's nothing better than knowing you just nailed it out of the park every visit. All of our providers are local, and so we were really vested in Bloomington Normal. Dr. Houghton's from Havana, I'll call that local. Dr. Hill is a graduate from U-High. I've been here over 12 years now, and my wife grew up here. And so we're vested in the community. You know, one of the things I think is very important about Bloomington Primary Care is that the physicians are here, they're going to stay here, and they're going to be here for lifelong. You know, I think it can be very frustrating to patients when they establish with a doc for 3, 4, 5 years, and that doctor leaves. They just have a job, and they just kind of quit their job, and they kind of go somewhere else. I have to admit, I did that for years. I was an employed physician for the first 12, 14 years of my career, and it was very difficult to watch patients go through that. And so that won't happen here. You know, our docs they're young docs with young families like myself, and we're here for a long, long time. Most people want to get a great doc that they know, and they don't have to worry about finding another one, and that's not going to happen here. With modern medicine, increasingly it's difficult for community primary care doctors to go to the hospital. And with a heart-wrenching decision earlier this year, we decided to finally not admit to the hospital. And that was hard for us, but it's just part of where medicine's going. We kept getting interrupted with the visits, coming out of rooms, dealing with hospital patients, showing up late from the hospital here and not running on time. So we really wanted to dedicate ourselves to the office visit. Additionally, we had confidence in the hospitalist program that is up and running in both Broman and now in St. Joe, and we integrate very well with them. And as part of that, we want you to know that we're still going to be involved in your care, even though we may not see you in the hospital every day. When you're admitted, we have our chronic care manager will call you and let you know we're here, and if you have any major problems, we can still drop phone calls to your hospitalist when you're in the hospital. As well as when you are discharged from the hospital, we'll see you often within 2 or 3 days. We have someone who will contact you immediately, make sure everything's fine, that you don't have any questions about your medicines or anything like that, and see you in short order. And that's called transitional care medicine. And that's kind of where we're at. So we're not going to be able to see you in the hospital anymore, but you have choices now. You can go to either hospital, and we're still very involved even though you're not going to see us. You know, there's times when you need to call a nurse. I get that, you know, where you really need a human contact. But there's a lot of times when you really don't necessarily need to talk to a nurse. You just need a refill. It's just that easy. Or you just need to make an appointment. It's just that easy. And so we would encourage people to try to gain confidence in using the portal more. Once you've done it once, you'll find it's effective. Again, the biggest thing is the stakes are high sometimes at that moment. So we want to coach you through that so that when you do need that refill, very importantly, you have confidence it will work. You know, if we can convince 15% of our patients to just start using the portal on very simple, basic things that really don't need a nurse, that's going to make my nurses have another hour a day. And so that's going to give them time to be more patient with people who do need to talk with a nurse, and more compassionate and patient for it. You know, and so when you do need to talk to them, they're not trying to clip the conversation short. So we would ask patients as much as possible, try to develop confidence, use the portal, you're gonna like it, it's good, everybody's done it, enjoys it. And it's kind of a win-win so that we can serve you when you do need a human being even better. There's a couple key skills we want people to develop on the portal, and we're willing to work with you and coach you. We can have an individual call you if you want, and we're going to have some modules on this webpage to show you how to do that. But we think everybody should feel confident about making an appointment or changing an appointment, a refill request, texting their provider, their doctor. And you can do that, like we talked about before, and get a quick, accurate, timely response exactly from the doctor, not the nurse trying to say what the doctor said, but the doctor saying it. And also review the records. On the patient portal, you can see everything that under the assessment plan. So for example, if you have questions about what I said, that I say increase your medication, you can visit the visit once I'm done and I've dictated it, it'll say there, I said, double your blood pressure medicine. So everybody should be confident about that, and as well as looking up, for example, their vaccine records, and then finally looking up their lab results. All your lab results are available online, and if you have any questions, you can call us, or we also have a dictionary on the web page on another part of it that kind of will explain, what does it mean when my MCV is up, and it'll give you most common reasons. And of course, if that's not satisfactory, then you can call us, or text us through the patient portal. Don't call, text it with questions, and then we can reply to it. So it's free, it's great, it's high quality, it doesn't cost you anything, and it's worth noting that you can access this either through an internet web page, and there's also a free app called Hilo. Now, admittedly, there's a few limitations. You can't do everything on the app, but we can kind of coach you through that. So some of these properties you can't do very well on the app, but a lot of them you can. So it's totally scot-free to the patients, no hooks, no nothing. And again, it's kind of a practice without walls. So we want you to have access to your record. Now, it's not the entire record, it's just what's called the assessment plan, because goodness help us, if people start saying, looking under, I didn't quite say it that way, or I didn't mean that. So we try to avoid that kind of nitpicking, but you do definitely have a right to know what your diagnosis is and what the therapeutic plan was. And if you have any doubt, you can look at it.